3, 2, 1, 1, 2, 3. Thank you for showing up today. I have a hunch how we can fix this coronavirus. Inside joke, never mind. Hey, there he is.
Seriously, send me that. Only on me for about 2 or 3 days at a time.
just clip this on here? Fields, do you think I can just clip this on here?
Yeah.
Okay. Yeah. I'm just gonna leave.
Okay, test. Are you doing sound check?
Test 3, 2, 1, test. Can everyone hear me okay? Test 3, I'm talking into our mic as well. Test 3, 2, 1. Test. We're doing a mic check for KFYI and just about every media outlet in the market. So, test 3, 2, 1. Test. Hi, how are you?
Good afternoon. Thanks for coming. We have spokespeople today from Maricopa County Department of Public Health and Pinal County Department of Public Health. Dr. Rebecca Sonnenschein, representing Maricopa County Department of Public Health, Dr. Shaunak McEisen from Pinal Department of Public Health. They have prepared statements, and then we'll take questions. Thank you.
Good afternoon. Last night, we received confirmation from the Arizona State Lab that one of the people tested for COVID-19 had come back as presumptive positive. The person is a resident of Pinal County and is a healthcare worker in her family. She currently is hospitalized in a Maricopa County hospital and is in stable. Public health investigators worked the night to identify and interview close contacts with this. Were provided on recommendations on monitoring for symptoms and how to prevent spread. This person has not traveled anywhere that COVID-19 is spreading widely, and we have not identified an exposure to COVID-19. For this reason, we are treating this as a sign of community spread. I understand that this sounds concerning. Important that people know that public health is prepared for community spread of flu-like illness every year. But there are three things I would like every person listening to, watching this, know to do to slow the spread. Number one, and I know you've heard this often, wash your hands frequently and for 20 seconds using soap. Number two, don't touch your eyes, nose, or mouth, which are the way that the germs enter your body. The combination of washing your hands frequently and not touching your face can decrease this. Number three, if you're sick, home. The three things that will be the most effective way to prevent the spread of this virus. Final thing that will certainly help is to please make sure when you're on social media and talking with family, friends, you're sharing accurate information. A lot of rumors out there right now. Excellent sources for accurate information are the county and public health websites and this. I'd now like to turn this over to Dr. Rebecca Sonnenschein from Maricopa County Public Health.
Good afternoon. I want to talk to you a little today about how community spread is going to change the public health response to COVID-19. But first, let me provide a little bit of perspective. Besides being an infectious disease doctor at Maricopa County Public Health, I'm also a mom, and lots of parents are coming to me to ask me about COVID-19. What I tell them is that just like the flu season, we're all responsible for staying home when we're sick and making sure that our kids do the same. I tell them that I review the new science every day for COVID-19 and that all signs are pointing to this disease acting a lot like flu in our community. The only difference is it's a little more contagious than the flu, and we don't have a treatment or a vaccine. The good news, though, is that kids tend to have milder illness and do not seem to be at high risk of severe disease. Now, a little bit more about our response. Before, when we just had 1 or 2 cases, our job in public health was to contain the disease and try to keep COVID-19 out of our community. Now that there is community spread, we all need to do our part to slow the spread, which means keeping sick people away from others. Just like the flu, the vast majority of people will have mild symptoms and completely recover without any treatment at home. Our older adults are at higher risk of severe complications, so they need to make sure that they stay away from anyone who's sick. Now I want to talk a little bit about our healthcare workers. Our healthcare workers are the front lines and they see sick people all the time. That is why they wear personal protective equipment when they treat people with respiratory illness. We ask our healthcare workers to continue to do what they do best, and that's treat their patients, and also to provide them accurate information. Per CDC recommendations, we are no longer going to keep healthcare workers home after they are exposed to COVID-19. We're asking them to monitor themselves daily for fever and symptoms of the illness and stay home if those symptoms develop. As long as they are not showing symptoms, we need them in our healthcare facilities. And now I'm going to go ahead and take a moment for questions. So the question is, what hospital did she work at? We are, in public health, we are obligated to maintain absolute confidentiality of the case. And because of that, we're unable to share anything identifying about the case and also anything that could be used to identify the case. And that is why we don't share that information publicly, regardless of what other organizations choose to release. The only time we will release information that can be used to identify a case is if it's important in order to protect the public's health. So unfortunately, I can't release that information. So we can't tell you specifically what day she was tested because that can help you identify the individual. What I can tell you is that we have been interviewing the case and close contacts, and we have identified all close contacts and have let them know that they have been exposed and what they can do to prevent the spread and to monitor for symptoms. And that has been done in the last 12 hours, which basically took an entire healthcare, public health workforce. The investigation is constantly evolving, and any number that I give you right now will be wrong in just a few minutes, and so we won't be able to release that information.
I completely understand the concern. What we are doing is we have an ongoing investigation and spread in the public. Our work to do that is ongoing. Certainly release that will help protect the public.
Does she work in Pinal County?
Go ahead.
Patient worked,
That is correct.
So again, that falls on are unable to share what we can. Yes.
What I can tell you that we do with severe flu is when we identify that there is a specific outbreak in a school, we will work directly with that school for an outbreak. And I can tell you that we are working with all the close contacts to determine if they are showing any symptoms, and if they do show symptoms, we will test as appropriate, and we will make sure that anyone who is exposed by those individuals is aware so that they can watch for symptoms themselves. So again, we're not going to give any specifics about the close contacts, but what we can tell you is that this case stayed home while she was sick, and that is why we really want to emphasize the importance of everyone, the public and healthcare workers, staying home when they're sick. This individual did not expose very many people at all because she was vigilant about staying home when she was sick.
Will you explain more how this happened? What did it
So I want to just add to what Dr. Sunenshine just said, and that is we are in such a powerful position to spread the word that will actually help decrease. So we are asking you, us spread the word. And if people wash their hands, touching their face, working together, we have that potential.
When did she self-report?
So the individual lives in Pinal County and works in Maricopa County. So we are frequently in contact with all of our healthcare partners, and what we're finding out now is that our resource limitations that are in the community tend to be in the healthcare system. So we're in constant contact with our healthcare systems, making sure that they have enough personal protective equipment and that they have enough staff. And then we're communicating that with the state public health department, who is in communication with the governor. So this illness affects people who are, most people who have this illness are mildly ill and will get better without any treatment. However, there are some people who will have more severe disease, particularly in the second week of illness. And this individual is one of those people who did end up having more severe disease, but she is stable and recovering at the hospital.
And I wanted to add to that what Dr. Sunenshine said, which is that is why we ask people to stay the entire time they're sick.
Explain what
So we can't answer for the state of Arizona, but what we can say is we have tested a number of people in Maricopa County, and currently we have testing in progress, and that number changes. Actually, it's probably changed in the last hour. So what we're more focused on is once a case is presumptively positive at the state public health laboratory, that is when we initiate a full investigation, find all those close contacts, and make sure they know to watch for symptoms so they don't spread the illness. So the reason why we are moving into a response that we do with typical seasonal influenza is because before this disease was spreading in our community, the CDC recommendations were for anyone who is exposed to the illness to be pulled out of work for 14 days. And now we're moving into what we would normally do during seasonal flu. If someone is exposed, we're allowing them to continue working, but monitoring them closely. And if they develop any symptoms, just like during flu season, then they stop working. And that is how we're making sure we're not in a situation where we don't have enough healthcare workers.
Right, so you want to know about what it means in terms of the public and community spread? Yeah. That's correct. So the definition, so what we look for in an investigation, have a positive test. Person have traveled to an area where there's widespread coronavirus. Number two, did this person have contact with a person who had that travel? Have not been able to identify those in this situation That's not to say that it may not have happened. It's just investigating this for 12 hours, which is a pretty short time, and that we are going to continue our investigation at this point in time. Right. And the definition of that is that we don't have the answers.
Timeline, did she?
At this point in time, we're not, and the reason for that is we're going to continue spreading so that we can get a more accurate of there is community spread and how widespread it is. Asking about the incubation. So the situation that all the evidence
So you're asking about how long it takes us to identify all those close contacts of a case. And the answer is the very first thing we do when we get a presumptive positive is we go and we interview that case very, very closely. That typically takes 1 to 2 hours. After we have that information, we have a lot of other individuals to follow up with, and we have the same intense conversation with them. We verify the information about how long they were exposed to the case, what kind of a setting they were exposed to the case, and based on the information about that exposure, we make recommendations to prevent the spread. So typically it takes a lot longer than 12 hours to get those long interviews done for each close contact. But I will say that we're in a position now where we have interviewed all the close contacts, and we are working mostly with those healthcare facilities to make sure that they are doing what they need to do.
Going into
So what I'm going to say to that is that really speaks to whenever any that's the message I have for everyone.
We have contacted all of the close contacts. The reason that we don't share that number is because it could change as we find out more information throughout the investigation. We're confident that we've reached those close contacts, but that number does change over the investigation.
like 10 or 20.
What I can confirm is that we have contacted all of them. So if you have not been contacted by public health, then you have not been confirmed to be a close contact.
I want to know.
I completely question but I want to emphasize our contacts are monitoring message helpful talking about here. That's going to have that's where the
was also at on this. That's
And I will tell you that we received 500 calls in an hour last night. So it's great that people want to tell us where they were to see if it overlaps with the individual. But when we put all of our resources toward answering 500 calls an hour, then we're unable to do the real work of working with those who are close contacts and working with those healthcare facilities to make sure that they do stay safe. So we ask you to think of this like the flu season. Are there certain areas of town that you don't go to because there's more flu there? No. This is a situation where I want you to think of it like there's probably some COVID-19 all over, and the best thing you can do is wash your hands, don't touch your mouth, your nose, or your face, and stay home when you're sick.
This, so you're wondering if the close contacts have presented with, so we're monitoring.
no.
I can tell you that at this time, we are still in the process of investigating whether they have symptoms that are related to the contact with this individual. So, as I mentioned before, we are unable to control what other individuals or organizations share about themselves or other information. We are legally obligated to maintain confidentiality of these cases in statute. And unfortunately, sometimes when you share little bits of information, like where that individual works, people can piece together what's out there in the media to figure out who the person is. And that is why we don't release the specifics, and we want to make sure that you take home the greater messages of how you can protect yourself and your family.
What actions you got?
I can tell you that we received a lot of calls last night related to all of our COVID-19 response, and that in general, we know that the public is concerned, and that's why we really want to make sure everyone understands that this should be treated like a bad flu season, and you all know how to prevent the flu, and you know how to prevent COVID-19.
Thank you. Thank you. Thank you.
What can you tell us about patient number?
Sorry, that's all the time we have today.
Come on. Come on. Health issue and you're gonna walk away? No,
For today,
we're not
we've got
we